It all started with 6 family physicians, 5 of whom were graduates of TCU, who were tired of driving back and forth to downtown Fort Worth without a highway or cell phones, determined to bring health care to the residents of the budding Northeast Tarrant County.
I had a lot of reason to have a hospital in our part of town.
Much of our time was spent traveling back and forth from our offices downtown, from our homes downtown, delivering babies in the middle of the night, and so forth.
We didn't have a hospital then, and when I was coming from town, I'd go through the back roads to get here in a hurry.
Mainly because we didn't like driving back and forth to deliver babies and see patients and this sort of thing, so we decided we'd build one out here.
So that's what we tried to do, and we'd worked it out.
Dr. David Pillow, a World War II veteran and father of 5, was the ringleader. With him was Dr. Bruce Jacobson, a gunner's mate in the Navy who would later serve as the director of the Family Practice Residency Program at JPS. Dr. Charles Rush, a doctor who loved horses and worked with the Fort Worth Rodeo. Dr. John German, a Bronze Star Medal of Valor winner in the Korean War. And Doctors Robert and Martha Chapman, the first married couple to be accepted to the UT Medical Branch in Galveston. The 6 worked together to form Glenview Hospital, thanks to funding from Rice University. And on Sunday, May 7, 1961, opened the hospital with a grand opening ceremony where their mentor, Dr. May Owen, gave the keynote address.
Many people in the community came up, and we were all there with our kids and whatnot. It was just a nice, quiet afternoon affair.
And then the night before it opened, Martha had a patient with appendicitis, and so we did an appendectomy before the hospital opened on the day before it opened.
Surgery was already set up, and the lady who was in charge of it was a go-getter, so she said, let's just do it. They were as excited about opening the hospital that evening as we were.
Also present at the grand opening was Hospital Administrator William Cotner.
Mr. Cotner was sort of a big guy who smoked cigars, and he was kind of brusque. At least some people thought he was.
Grand opening, a young child was kind of wild and woolly and running around, ran into a glass door and broke it and had minor injuries, nothing bad. But Mr. Cotner immediately went to the mother of the child and said, we're not going to sue you for what he did. He let it know real quick that it was their fault in his mind.
But he did what was best for the hospital all the time.
We were fortunate to get him to open this hospital because we didn't know anything about managing hospitals. So that wasn't our reason for having a hospital in the area. We didn't want to manage it. So with his able administration, we did fine.
The hospital opened with 60 to 70 employees and charged $7.50 a day for a double occupancy room, or $12.50 a day for a private room.
Glenview was very small, very family. There was, as you came in the front door, there was the switchboard operator who acted as the receptionist, and she even had that thing where you plug things in.
Our department was so small, we had 5 chairs in the waiting room for the ED and radiology.
White uniforms, white hat.
We did wear scrubs in labor and delivery, but it was the good old white and the hat.
Patients smoked in the hospital. You know, we had one physician who would come for a delivery, and he'd leave a cigarette sitting on the scrub sink while he went in and delivered, and then came back and got it.
We had a good staff, and I think we were very fortunate in opening a facility like this.
We had family practice physicians. They also did their own anesthesia. If we had a general anesthesia, they did call in a CRNA to come in. But it was like a family. It was a happy time.
You were really just all a part of their family. And they came to you for everything, and if you directed them wherever they needed to go or you took care of them, there wasn't all of the difficulty with records and with HMOs and all these things.
It was just very friendly, very family, very, country type atmosphere, so.
And I think the patients that came to Glenview were people that were in this immediate community. and the doctors always strive to do a great job.
In the late 70s, early 80s, we had 2 delivery rooms back in OB. We had 2 delivery rooms. It was actually one large delivery room with 2 beds. So you could have 2 women delivering at the same time with just a curtain between them. So it was very intimate.
In 1983, Glenview moved to its new campus and changed its name to North Hills Hospital.
There was an option to build the hospital here or move it down on 820, and they decided to put it here, and it roughly took a year, which was pretty fast for a hospital.
There was a big change because we went from cubicles to wonderful labor room that was just gorgeous.
When we moved to the new hospital, we got a new CAT scanner about 6 months after we moved in, and that was tremendous technology at the time. So that was quite a leap for us to go from the old equipment to new equipment with much more of it so we could service the patients much faster.
The 90s brought in computers and a new cath lab at the hospital.
We had lots of new ideals coming in. We had technology changes. We had hospital expansions going. We had new administrators come in.
Back in the 90s, we had to prove ourselves. We had to show the community and show ourselves that we were something special. And when we received that 100% perfect score from the Joint Commission of Accrediting Hospitals, we were the first hospital in the DFW ever to get a perfect score. So it kind of gave us that symbol, if you will, that we could do it if we really put our minds to it. And then I think the other really big award that we're so proud of was the Level 2 Chest Pain Center accreditation. Being the first hospital in the United States to achieve that really verified that if we had a focus, and in this case we had a focus on cardiac care, we could take it to levels that nobody had ever gone to, and that was pretty exciting.
Today, North Hills Hospital is known nationally for its award-winning chest pain care. It offers the largest senior clinic in our community, an institute for orthopedics, the latest surgery technology, including the Da Vinci robot and O-arm imaging. We continue to offer state-of-the-art women's services and recently opened a brand new therapy and cardiac rehab facility.
When I look towards the future about what it's going to be like and what we have today with new technology and even the senior clinic, being able to take care of a large growing Medicare population, it's pretty exciting for North Hills. The Da Vinci robot, I think, is really exciting, and it means shorter length of stay and better care for our patients. But I think the bottom line at the end, as exciting as technology is, we still have to remember what our founding fathers had in mind for this hospital, and that's to serve and to care for our patients and their families. And I think that's ultimately going to be the thing that singles out North Hills as far as a legacy for the future of our community.
Glenview and North Hills were probably, in my life, they were part of my life, not just a job.
I'm glad to be a part of the fact that there is a hospital out here like this today, and a facility that was not dreamed of in the days when we started out.
But I think they've done a wonderful service as far as the community is concerned. And that's what we needed the most, was the service for the people in the community.
We still have that family atmosphere now. We're just a whole lot larger and a bigger family.
What more can I say than the fact that we needed a hospital? I was able to help start one, and look what we got.
High tech is really great, but you got to have high touch. And I think if we're really to uphold what our founders gave us, the 6 physicians, they taught us to be compassionate, to care for our patients, and to serve them. And I think in the end, that is what's going to be the difference for North Hills in the next 50 years.